I think it's a really important one because this debate seems to go on and on. When we look at cholesterol, because this again, lots of my listeners are like me; they're in perimenopause women. We see the shift in cholesterol, right? We see that LDL starts to go up, HDL goes down. I've noticed it with mine, but then I also don't have the greatest genetics. So despite everything I'm doing, my understanding, I had a conversation with Dr. Ids just last week, is that there does seem to be this link between, despite what the carnivore community tell us, that as LDL increases, there is a link to increased risk of cardiovascular disease.
Oh
Is
yeah,
that right? Because
yeah.
there's some people will say, no, it doesn't matter, and it doesn't matter unless it's oxidized. But my understanding from the studies is that there is this linear risk. Could you clarify for us?
Yeah, so this is where I got to step in as a medical doctor, because this is the type of dialogue that we should be having with our physicians. The people who are trained to think about overall preventative health, preventative cardiology. To me, so let me first say, LDL is correlated. High LDL is correlated with a higher risk of cardiovascular disease. Period. End of story. We know that for a fact. LDL cholesterol is the kind that tends to stick like Velcro to the sides of our arteries. And then when it builds up, you get a plaque, you get narrowing. And when you build up enough, you don't get good blood flow. And that compromises not the heart, not only the heart, but our muscles and our brain. And it makes it harder for us to get the oxygen and the nutrients the oxygen we breathe and the nutrients that we eat to every organ and every cell in our body, including the heart. So the increase in cardiovascular disease is incontrovertible from a medical perspective. Okay. And I'm somebody that does, integrative and holistic, functional medicine, as well as like the hardcore ICU style medicine. So I'm just telling you, like, that's not even like that, is the earth round? Yes, it is. Is LDL harmful? Yes, it is. You got to have some, but you don't want to have huge amounts. And it's the ratio between LDL and HDL. Okay. So where does the biggest confusion about cholesterol come from? Well, I'm going to confess something to you, which is when I was in medical school, this is some decades ago, we were taught that any cholesterol is going to be bad cholesterol. So total cholesterol was the marker that you look for as a signal to whether you're at risk for heart disease. And we didn't have LDL and HDL. We didn't even know that stuff. We didn't have ApoE and all these, chylomicrons and all the other knowledge that we have now at a very, very specific level of oxidized LDL, et cetera. We didn't. So this is where I guess it's not a myth because it's kind of true. When you have really high cholesterol, like genetically, some people have ultra high cholesterol. I remember when I was in college, I had a classmate who, his cholesterol was like in the like almost 1,000. Like his blood was milky, was how high it is, and he had a genetic issue. And his father died when his father was 40. It was frightening. And he showed me a tube of his blood once. He came back from the doctor. I'm like, how could that possibly be? Yeah, that's all cholesterol. So even for me in medical school, I was trained as a young doctor that any cholesterol is bad. It was only really in the last 20, 25 years we began to say, no, you know what? The story's more complicated than that. The body's more complicated. Cholesterol is made of different types of elements. You got HDL, you got LDL, and how the ratio makes a big difference. You want more LDL, you want less HDL. And yes, the form of LDL is important. And now the ApoE component, we're drilling deeper and deeper. And without going into the jigsaw puzzle. So think about it, like the Sistine Chapel. If you had 1,000-piece puzzle to try to build the Sistine Chapel, all right, we're still putting this cholesterol story together. So we don't have all the answers yet. But I would tell you, total cholesterol used to be the signal for whether or not you're at risk for heart disease or not. But that's not the whole story. We really need to look at LDL and HDL, the ratio. You want more HDL, protective cholesterol, and less LDL. LDL is the type that sticks like Velcro to the walls of the blood vessels. So you want more HDL and less LDL. Ratio is important. Then the fine details coming out there. But I would say anything that you might hear to the contrary isn't supported by the facts. And I know, for example, you mentioned Dr. Is like he's a very factual guy. He likes to stick with the facts and stick with the data. I know him, and one of the things that I really appreciate about pragmatic doctors is it's very important to stick to our knitting. When there's something we know to be true, we shouldn't veer from that unless there's new evidence that suggests otherwise. And a lot of this other noise around cholesterol, you got to be careful about where this information is coming from, and always ask, what is the source of the data? Can you show me the data for it? And I think that's really important.
I agree, because I think the world's kind of gone a bit like, I must manage my blood sugar, I must keep it within this super tight range. And now we're seeing people kind of like their blood work's changing in terms of their triglycerides, their cholesterol, their, all these things. And it's like, just because I've got to keep my blood glucose here, when my understanding, again, it was something I discussed, Dr. Is, it should go up. There should be a
Yeah,
bit of a spike
yeah.
when you're eating, and you
I
shouldn't
got,
cut out fruit
I
because
gotta say a little thing here. I know we're beyond our time, but here's the thing. Anytime that influencers actually drive up anxiety about an idea, it can lead to a problem where people who are not as well educated or not as capable of following the science and understanding the nuances wind up getting not so much purposefully misled, because I think most of the people who are messaging about blood glucose, for example, glucose control, they're well intentioned. But I think we have a responsibility, if we're communicating to the public as experts, to be able to be aware and appreciate that our messages can be easily taken to an extreme. So I wanted to say this about blood sugar and blood glucose, which is, they're really, with a few exceptions, which you don't generally see, there's really no real such thing for most people as a blood sugar spike and a blood sugar crash. The spikes and crashes are just words that people understand, because nobody wants a spike and nobody wants to crash, but that's not actually what happens in real life for the most part. If you have a real spike or real crash, you're probably on your way to the hospital, or you're in an emergency room, or you're in ICU. And I think that this is why we have to take on the mantle of responsibility, to be able to try to use the clearest analogies that people understand, but also provide the framing and provide a little bit of the nuances, so that we don't just make people feel things are black or white or working at extremes. People understand extremes, of course, but that's actually not how the body works. The body actually doesn't like to be at the extreme. The body likes to be set in the middle. And just like we're talking about metabolism, the hardwiring, at the end of the day, one of the most important things we've talked about is that we have the ability to try to stay in the middle. When we're not mindful of our health, we tend to stray towards the extremes. That's not good for our health. That's not good for longevity. We want to make little moves that can actually help our body naturally come right back towards the middle. That's balance. Balance is a core to preventative medicine for health, for longevity, and it's present in virtually every system of medicine around the world, except for Western medicine, which is trained to look for extremes. And so that's why, even though I'm trained in Western medicine, I help to develop cancer drugs and diabetes drugs and treatments for blindness. Like I'm a full bore kind of like believer in modern medicine. But the one thing that we have to do is to understand how the body actually works. It's very difficult to do better than what the body's capable of.
yeah, it's amazing. It will always find that kind of homeostasis, right? Especially if we do all the things that you're talking about here. Amazing.